Question number 2. Can we tell you if or how we can correct your vision if you email us or call us, but we've never seen you in person as a patient in our practice? Unfortunately, the answer is no. In order for us to give you worthwhile, credible answers to your questions and to offer recommendations that are substantive and of value, we have to see you in person in one of our offices here in Austin, Texas. Unfortunately, we can't offer medical advice via virtual consultations, telemedicine, email, or phone consultations. So question number 3, why can't we answer your questions virtually or if you email us or call us with your information? It's because we need to obtain a library of diagnostic tests of your cornea, your retina, the spatial dimensions of each eye. We need to understand the retina condition, your optic nerve condition. There's a whole host of data points that we need to obtain in person. Plus, we need to get to know you. You need to get to know us. That relationship has to be formed. And we need to physically look at your eyes through a microscope to ascertain all the subtle details that we need to know in order to determine what your best options are. Question 4, what if you send us all your medical records? We review them. Then can we answer all your questions? Unfortunately, no. We still need to see you in our office for the reasons that we mentioned earlier. And if travel to our office is not realistic, we completely understand. Question number 5. So how often do patients travel from out of state or out of the country to come see us? Pretty much every day we see patients traveling from far and wide to come see us for a second opinion. So it's pretty common.